And thank you very much for presentation of this comprehensive report. And thank you very much for the good example of the fruitful cooperation between European agencies, European institutions. It is this report, it is a good reference point for the EMCDDA, Europol and Commission and all of us to prepare and to implement the strategy in coming years, and also this is a good background for policies addressed to the drugs problem. What are the challenges, as you expressed and as you mentioned it? Firstly, increasing ecosystem, production, trafficking, distribution for drugs related to the specialization of some groups of the organized crime, building new forms of alliances across ethnic and geographical boundaries. The economic impact, as it was said, is growing in the negative sense. The value of the drugs market is estimated at the level between 21–31 billion every year. Point 2. Concentration in number of established and emerging geographical locations in Europe, with specialized channels for delivering drugs from European sources, new and emerging zones of production, and from different parts of the globe. It is the example of globalization of the drugs criminal business chain. It is also clear that the Internet creates the new possibilities of promotion of drugs and dissemination of the knowledge how to use and obtain them. The role of the darknet is growing in that area. And point 3, the multidimensional impact of the growing drug markets and the easier accessibility of drugs, especially those new psychoactive substances. This impact is destroyable for the economy, for the people's health. 1% of European adults use drugs on almost daily basis. It means 6 million people. And it is also adds to the radicalization of social attitudes in some countries. There are also questions on the evidence of the links between drug markets growth and terrorist activities, the background for instability and financing of the terrorist actions. If we want to implement our policies as a response to those description of the market and drivers of the market, we need to focus on, firstly, systemic analysis and prognosis of the trends of the drug market business and the new patterns of using drugs, also of the new risks for people because of the new composition of drugs, which is key for operational and policy purposes. Second, partnership between all institutions involved in active policies at the European level and at national level, the role of focal points in EMCDDA activities. Better cooperation between EU institutions and Member States is necessary for development of the early warning system. Strong and fast interventions blocking the access to the drugs and NPS. We know that it is not easy. We understand that there are many critical points and there is hard work between Member States, among Member States, on the new solutions related to NPS, and we hope that in a short time we will achieve some solutions. The lack of coordination can increase all kinds of risks. And the third point, balanced policies is needed for drug supply reduction and help for people experiencing drugs problems, which is the area for public health policies and I think it should be great from time to time to organize a common meeting between our committee and Environment Committee, which is also in the competences of this committee, is the health and public health. In that context, I want to ask Mr. Gusdil, what kind of capacity EMCDDA need for fulfilling its role in creation of these policies? Is the new framework institutional, legal, for better cooperation and coordination needed? And how can we better tackle the growing problem of new psychoactive substances, especially dangerous because of unknown and uncertain efforts of using those substances? Thank you very much.